All right, so we're back again. We're going to teach Christian some corrective exercises. So what I have here on the chair, we're going to really work into thoracic extension because that was the thing that I did to get mobility restored with the manipulation. So we're going to work into thoracic extension. One of the best things I like to do is repeated extension over the edge of a chair. And so you want to have a chair that kind of hits them in the mid-back. And then the other thing that I like to do, especially to extend the upper thoracic spine, is a chin tuck with a slight overpressure, kind of like a Mackenzie approach. And so what I'll have you do, Christian, is go ahead and sit down on the chair and kind of scoot all the way back so your back is against the pillow. And I put the pillow there because sometimes it's a little bit irritating if you don't have a well-padded chair to backward bend over the top of it. So what you're going to do now is put your hands up on your head like this, okay? You're going to tuck your chin slightly, okay? Not a huge tuck like this, just a slight chin tuck. All right, so put your hands more up on top of your head. There you go. And elbows in, okay? Slight chin tuck. And then essentially lead with your shoulders and backward bend over the top of the chair until you feel a stretch in your mid-thoracic spine. Okay, and he gets some great mobility. He's got a young, healthy spine, so that's awesome. That's what we want to see. How'd that feel? Good. Okay, so what you're going to do is you need to do this hourly, right? Because that window is only open for so long. If you go too long without doing your corrective maneuver, then the window closes.
Okay.
See what I'm saying?
Yeah.
And that's kind of where I disagree with some of my colleagues in healthcare. Is they take a passive approach and they fix things with their hands, which is great. They do the manual therapy stuff, but then there's like no corrective exercise to maintain the benefit. And the proof is in the pudding, so to speak, with the research, because that window of benefit is only open for so long, and then that neurophysiological benefit is gone. So hourly today, for the rest of work, you're going to do a few of these. When you're in cleaning a room, do a few.
Okay.
Put a pillowcase on, you're out of there.
Okay.
Next time you clean a room, do a few. Okay, you got to you want to link it to something that you do often. One thing that I used to do, and I have to be guilty as charged that I don't do it anymore, is whenever I'd walk in and out of a treatment room, I would do a little thoracic extension and go on and do my thing. So I'm in and out of treatment rooms all day long, right?
Yeah. Okay.
So I do that a ton. So you got to try to engage the patient to do their exercises when they're doing something they do often. That way they get their reps in. They don't have to be like, oh, Dr. Steve says I got to do my exercises. It's 4 p.m., right? If they tag it to something that they do a lot, they'll be more accountable with it, and they'll get their reps in. Okay, so you got that one. You're going to do that hourly. 5 times an hour, 5-second holds.
Okay.
So easy to remember, 5, 5.
Okay.
Cool? The next one, to get the upper thoracic spine extending, we're going to do a chin tuck. So I cued you on this off camera a little while ago too, but imagine someone's blowing onions in your face and it's like, ooh, I don't like that. So we want to keep the head facing forward, but you're just trying to get away from that person with a bad breath. So you're going into a little bit more extension than we'd like. So right there, relax everything. Someone's blowing onions, straight back you go. Okay, then take 2 fingers right on your chin, so index finger 2, and just give it an extra little nudge. Hold and relax. Now you don't want to extend, right? You want to go straight back, like get away from me, and then a little bit more distance between you and that person. Okay?
Okay.
So someone's blowing onions, straight back you go, straight back this way. 2 fingers on the chin, a little bit of overpressure, like a pound or 2 of overpressure, not much. Hold it for 5. You relax.
Okay.
You do that along with the chair exercises. Then let's talk in a few days, see if anything resolves.
Okay. So stretch and then that. Okay.
Yeah. Hands up here, over the top of the chair. 5-second holds, 5 times an hour. Onions in your face. A little bit of overpressure, distance yourself from that person a little bit more. 5-second holds, 5 times an hour.
Okay.
Cool? Cool. All right. Thanks for watching, everybody.